This will be a single patient encounter. You will have 20 minutes to complete this encounter. Do you have any questions?
I have no questions.
You are working single coverage at ABEM General Hospital. Here is your first patient.
Thank you. As I walk into the room, what do I see?
You see an elderly male in no acute distress sitting on a stretcher with some dried blood around his nose.
Hello, Mr. Smith. I'm Dr. Moayedi. What can I do for you today?
Well, doctor, my wife really forced me to come get my nose checked out. I fell and hit my face on the ground.
I'm sorry to hear that. What happened exactly?
Well, you know, I'm not exactly sure. I was walking to the bathroom, and I felt a little bit lightheaded. Next thing I knew, I woke up and I was on the ground, and my wife was standing over me.
So there's a period of time that you don't recall?
Yeah, I guess so.
Before falling, did you have any symptoms of feeling lightheaded or having your heart beat funny or chest pain, shortness of breath, anything like that?
No pain or shortness of breath. I did feel a little bit lightheaded, and now that you mentioned it, I've been feeling lightheaded off and on for the last couple days, I guess.
Have you passed out at all the past couple of days?
No, I haven't.
I see. Is your wife available?
She is. She's here with me today.
Hello, Mrs. Smith. Can you tell me what you saw?
Well, doctor, I really don't know. I was downstairs making some tea in the kitchen, and I heard a loud thump, and I went upstairs, and George was lying on the ground, and his nose was bleeding, and he was unconscious, but he seemed to wake up right when I got there.
I see. Mr. Smith, do you have any medical problems?
I have high blood pressure.
Okay. Do you take any medications?
I take a Tenolol.
Is that the only medication that you take?
That's my only medicine.
All right. And tell me, do you smoke cigarettes?
I do not.
Alcohol?
Rarely.
Right. Any significant family history?
I guess high blood pressure runs in my family, but that's about it.
Okay. Nurse, I'd like you to obtain a finger stick on a patient, and as well as a pulse ox. I don't see a pulse ox on this, vital signs. And could you put them on a monitor, please? Obtain IV access, left antecubital vein, ideally large bore, and draw some blood work for me. And we'll hold those until I speak to Mr. Smith further. I also would like an EKG.
Certainly, doctor. His finger stick is 110, and his pulse ox is 98% on room air.
Wonderful. I'm going to continue with my assessment of Mr. Smith. Mr. Smith, have you had any chest pain at all the past couple of days?
No, I haven't.
Have you had any shortness of breath?
None.
Fever?
No.
Cough?
No.
Any nausea or vomiting?
No, I haven't.
Have you had any dark stools or diarrhea?
No, I haven't.
Any bright red blood per rectum?
None.
I see. Do you have any abdominal pain?
No, I don't.
Okay. Do you have any neck pain currently?
No. It seems like the only thing that hurts is my nose.
Do you feel any weakness or numbness or tingling in your arms or legs?
No.
All right. Well, I'm going to continue with my physical examination of Mr. Smith. As I examine his head, eyes, ears, and nose and throat, what do I see?
What specifically are you looking for?
Is there any anisocoria?
No, there's not.
Is there any hematympanum?
There is not.
Evidence of battle sign?
No.
Are his teeth intact? Is there any false teeth?
There is no dental injury that you can see.
All right. Tell me more about the nose. Is there any deformity?
He has a minor deformity of his nose with a small amount of tenderness to palpation.
Any laceration?
No laceration.
Is there any active bleeding from the nares?
No, there is some dried blood, but no active bleeding.
As I look inside of the nares, is there any evidence of septal hematoma?
There is not.
Okay. Is there any tenderness on the C-spine?
His C-spine is non-tender.
Moving down the thoracic spine and the lumbar spine?
His entire spine is non-tender.
Or lung exam?
His lungs are clear to auscultation.
Cardiovascular exam?
His heart is mildly bradycardic, but otherwise has a normal S1, S2 without appreciable murmurs.
And what do I see on the monitor as I'm examining him?
I have your EKG, doctor.
Oh, wonderful. I see this is a type 2 second degree heart block. Nurse, can you place external pacer pads on Mr. Smith and have the pacemaker ready to use as needed?
Certainly, doctor.
What I would like to do with the labs that we drew earlier is to send for a cardiac panel, as well as CBC, chemistries, and coag screen.
I'll be happy to take care of that, doctor.
All right. Continuing with my physical exam, abdominal exam.
His abdomen is soft and non-tender without any masses that you can appreciate.
All right. No bruise?
No bruise.
Okay. Any tenderness on the pelvis?
There is none.
Extremity exam?
He moves all four equally with good strength. There is no edema.
Okay. All right. And overall skin exam?
There is no evidence of bruising, and he has normal tone to his skin.
Wonderful. All right. Well, what I would like to done is to page our cardiology service.
Certainly, I will locate that doctor for you, Dr. Moayedi.
All right. Mr. Smith, what I have seen based on the EKG and my physical exam on you is that your heart is in a condition called a heart block. And intermittently your heart stops beating properly and your blood pressure drops, and that's the reason you fell today. Your nose seems to be broken. Physically examining you, it looks like there is a mild deformity, but this is of minor consequence, and this is something that we can address later on. I can arrange for follow-up with an ear, nose, throat specialist. But what I'm really concerned about here is your heart, and we're going to need to keep you in the hospital. Do you have any questions?
Well, it sounds pretty serious, doctor. I'm happy to do whatever you say. Is this something that's life-threatening?
Yes, if not treated, this can be life-threatening. For instance, when you passed out earlier, that was because your heart was not conducting enough, it was not beating properly, and that's why you passed out. And if this were to go on for a prolonged period of time, it could be life-threatening, yes.
I see. Well, thanks for informing me of all that.
Do we have the cardiologist online?
I am trying to get a hold of him, doctor, but you know, Mr. Smith says that he's sort of feeling lightheaded again.
Let's go back and evaluate him. What do I see?
Here's his rhythm strip, doctor.
Okay. And how does Mr. Smith look as we are checking those?
He looks slightly pale and diaphoretic.
Okay. Let's repeat a set of vital signs. What I see on the monitor strip is that he is in complete heart block now. Let's go ahead and turn on the pacemaker with a rate of 70.
Very good, doctor. I turned it on and you seem to have electrical capture.
Is there a good pulse?
There is a good pulse with that.
Okay, at a rate of 70?
That's correct.
All right, let's draw up some Ativan and pain medicines. Mr. Smith, are you uncomfortable with the pacemaker?
Ooh, I sure am. That's it's really quite uncomfortable.
Well, let's go ahead and administer 1 milligram of Ativan as well as 4 milligrams of morphine. But prior to administration, Mr. Smith, do you have any drug allergies?
Just the penicillin.
Okay, so let's go ahead and administer the medicine, and let's check up and see how he's feeling with that.
Oh, that's really helped quite a bit, doctor. Thank you.
Wonderful, wonderful. Do we have our cardiologist on?
Yes, I have the cardiologist on the phone for you.
Hi, this is Dr. Moayedi. I'm calling from the emergency department. I'm calling in reference to a 75-year-old man by the name of George Smith, who presented with a syncopal episode, but it turns out that he at that time was likely in complete heart block. His EKG revealed second-degree type 2 heart block, and he's currently being paced because he was symptomatic and was transiently in complete heart block. I would like to transfer him to your CCU service for implantation of a permanent pacemaker.
That sounds great, Dr. Moayedi. We have a bed available, and we'll take care of getting a pacemaker placed later this afternoon.
Wonderful. I should say that he's injured his nose, but that's something that we can address later.
Very well. Thank you, doctor. This concludes this case.